The LUX DX Insertable Cardiac Monitor (ICM) system is designed to monitor and record your heart rhythm for clinical evaluation. Your doctor may recommend it because you have experienced symptoms such as fainting, heart racing or fluttering, shortness of breath, or lightheadedness that may suggest a heart condition. You're at risk of developing an abnormal heart rhythm, or you have a known heart condition that your doctor wants to monitor. The LUX DX ICM collects information for your healthcare provider to evaluate cardiac arrhythmias. An arrhythmia is when the heart is beating too fast, too slow, or in an irregular pattern. The LUX DX ICM monitors and records these rhythms. It does not treat them. Identifying and monitoring arrhythmias can help your healthcare team provide better care. The LUX DX ICM system has 3 parts. 1, the insertable cardiac monitor, also called an ICM. This small device, about the length of a paperclip, gets inserted under your skin. 2, the LUX Patient app. You'll be given a mobile device with this app pre-installed on it. This mobile device cannot make phone calls. The LUX Patient app uses Bluetooth wireless technology to collect heart rhythms stored on your LUX DX ICM to send to your clinic. 3, a blue magnet. This is required for initial setup of the LUX Patient app. Your healthcare team will let you know if they want you to use it for anything else. Let's look at how these parts work together. Each day, the LUX Patient app will automatically collect data from your implanted device and send it to your clinic. This generally happens overnight and will happen without you noticing. The clinic will look at your data during clinic hours. They will contact you if there's a need for further review. For the most part, the system works on its own and doesn't require much from you. You'll have just a few responsibilities to ensure your care team receives all the information needed to provide you with the best care. 1. Connect your mobile device to the charger each night. 2. Place the mobile device within 6 feet of where you sleep at night. 3. If you see a screen with an exclamation point icon, follow the instructions on the screen to get reconnected. You will know when you are reconnected when you see a screen with a check mark that says your monitoring is up to date. This introduction should give you a good overview of how the LUX DX ICM system works. You can find many answers to questions you may have in your Quick Start Guide and Patient Handbook, or call Boston Scientific at 866-484-3268. If your healthcare provider has recommended the LUX DX ICM system, you're probably wondering what the insertion procedure will be like. The procedure will start with local anesthesia to numb the area. The provider will make a small incision. Usually the incision is on the left side of the chest, but your healthcare team will determine the best place to insert it. The LUX DX ICM is small, about the length of a paperclip. It runs on a battery that's safely sealed inside the device. After making the incision, your healthcare team will insert the LUX DX ICM under your skin. After it's inserted, the incision will be closed. Your healthcare team will send you home with care instructions. While you may experience some discomfort after the procedure, recovery should not prevent you from returning to an active lifestyle. Be sure to contact your healthcare team if you notice any swelling, warmth, or drainage around your incision. Also, call if you develop a fever while your incision is healing. Keep in mind these side effects are unlikely, and recovery from your insertion procedure should not prevent you from returning to an active lifestyle. Have questions about the insertion procedure? You can find many answers in your Quick Start Guide and Patient Handbook. Or call Boston Scientific at 866-484-3268. Once you've had your LUX DX ICM implanted, it's time to set up the LUX Patient app installed on the mobile device provided at your procedure. Your healthcare team may help you do this in the clinic, or you may be asked to do it at home. If you've been asked to do it at home, don't worry. We'll help you through it in just a few steps. First, let's look at what the healthcare team will send you home with. A mobile device in a case. It may look like a normal smartphone, but this one is a little different. It will already have the LUX Patient app installed. That's the program that will send data from your ICM to your healthcare team. Note that this is not a phone you can make calls on. In case of emergency, be sure to call emergency medical services on your regular phone. A cord to charge your mobile device. A stand for the mobile device, a blue magnet, an instructional booklet, a quick start guide to help you set up your LUX Patient app, and a temporary medical device identification card. Now let's talk about how to get your LUX Patient app set up. Step 1. You should see a circle on the back of your mobile device case. This is a two-sided adhesive that you'll use to attach the blue magnet. First, peel off the backing of the adhesive. Then attach the blue magnet to the mobile device. Place the side of the magnet with text on the adhesive and press firmly. Step 2. Press and hold the power button on the right side of your mobile device to turn it on. Once you see the screen turn on, you can let go of the power button. Tap the LUX Patient app icon on the screen to open your app. If you see the screen that says your monitoring is up to date, you're all set. You can skip Step 3. Step 3. The app will be automatically set to English. If you want to use the app in English, tap Next. If you want to change the language, please refer to your Quick Start Guide. Tap Start Setup and follow the on-screen instructions. Make sure you have the magnet attached to your mobile device or located nearby for the next steps. Once you're connected, you'll then see the Your Monitoring is Up to Date screen, which means you're all set up. If the app tells you it is having trouble connecting, use the help provided on the screen and in the handbook for instructions. Now that your LUX Patient app is working, there are just a few things to remember. Keep your mobile device powered on and charged. You can let it go to sleep, but do not use the power button to turn it off. You do not need to carry it with you during the day unless your healthcare team has asked you to do so. It may be easiest to simply keep it plugged in and on the stand near your bedside. At night, use the cord to charge your mobile device. The cord inserts into the bottom of the device. Be sure to place the mobile device within 6 feet of where you sleep. This will allow it to connect to your ICM and send data to your clinic. If you see the check mark icon, your monitoring is up to date and no action is needed from you. Your data is getting to your clinic. If you see a different screen with an exclamation point icon, the mobile device is disconnected. This is not a signal that something is wrong with your implanted device. You just need to follow the instructions on the screen to reconnect so your healthcare team can receive your data. You will also see a Learn button on the LUX Patient app. You can press this at any time to learn more about how your LUX DX ICM system works. Have questions about setting up your mobile device? You can find many answers in your Quick Start Guide and Patient Handbook. Or call Boston Scientific at 866-484-3268. Sometimes it can be helpful for your healthcare team to review how you were feeling at a certain time alongside the heart rhythm data recorded by your LUX DX ICM. So they may ask you to record information about symptoms you're experiencing. Not everyone who has the LUX DX ICM needs to do this. Your healthcare team will tell you if you need to record symptoms. If requested, you'll use the MyLux Patient app to record symptoms like fainting or shortness of breath. When you experience a symptom your healthcare team has asked you to record, try to record it as you are experiencing it, or immediately after. Here's how. Step 1. Tap Record Symptoms on the main screen of the app. Step 2. Follow the instructions on the screen. This will help your clinic understand what you were feeling and what you were doing when they review your data later. Hold the magnet attached to your mobile device over your ICM and wait for your mobile device to vibrate. Step 3. You will see 2 questions. First, you will be asked about the symptoms you experienced. Select all that apply. Then you will be asked what you were doing when you experienced those symptoms. Choose the icon that represents what you were doing: lying down, sitting, standing, or moving around. Step 4. Once you see a screen confirming your symptom was recorded, tap Done. The MyLux Patient app will store the symptoms you've noted along with the heart rhythms your ICM has recorded and send them to the clinic the next time your data is transmitted. If you ever experience a symptom that requires emergency care, be sure to call 911. The app will not connect you with emergency care. Have questions about recording symptoms? You can find many answers in your Quick Start Guide and Patient Handbook. Or call Boston Scientific at 866-484-3268. Sometimes your healthcare provider will call to ask you to send a manual transmission. This is a quick, easy process that sends the data from your device to your clinic manually. It is important that you only do this when your clinic asks you to. If your healthcare provider asks you to send a manual transmission, follow these steps using your MyLux Patient app. Tap the menu icon in the upper left corner of your app's main screen. Select Manual Transmission. Follow the instructions on the screen. Connecting may take several minutes. Watch for a message confirming it's complete. Tap Done. This means your data is on its way to the clinic. Your healthcare team will contact you if they need anything else. Have questions? You can find many answers in your Quick Start Guide and Patient Handbook. Or call Boston Scientific at 866-484-3268.